Hi, everyone. Welcome to the Oregon Immunization Program's training on immunization law in Oregon schools and children's facilities. My name is Stacy Deassis Matthews. This training is about reporting and is for sites that use computer systems such as approved student information systems to generate their immunization reports. If you are filling out report forms manually, please watch our other training. You can email our team at oregon.imm@odhsoha.oregon.gov if you have questions that come up during the training, or if you'd like to request this training in a different format. Let's get started. This is a series of trainings that covers the immunization review process in 3 parts: requirements, Alert IIS, and reports. This is part 3, reports. To set up for success when immunization reports are due in the winter, there are some important fall activities. First, make sure to enter all the immunization and exemption dates you have for each student in your SIS. This is key so that the reports have all the data to be able to run correctly. Check Alert IIS for students missing immunizations. You can watch the part of this training about Alert IIS to find out how to get access to this system. For students whose records are incomplete, learn how to send the parent letter from your SIS. Sending these letters in the fall helps give families time to make an appointment, get needed immunizations, and get the records back to you before the report is due in the winter. And finally, spend some time learning how to run the immunization reports that are due in the winter so you're prepared when those reports are due. Let's go over some important due dates. The primary review summary, also known as the PRS, pages 1 and 2, are due by January 15th, 2025. Then the local health department has 3 weeks to mail exclusion orders to families of children missing documentation of immunization or exemption. The letters will be mailed by February 5th this school year. Exclusion day is February 19th, 2025. This is the deadline by which all children must have up-to-date documentation of immunization or exemption on file with you, or by law, they can't come to school or childcare until that documentation is received. And then you have a set of follow-up reports to do. The primary review summary PRS pages 2, 3, and 4, due by March 3rd. For the first report in January, you'll be able to run this report in your SIS. It categorizes all the immunization records in your system as complete, non-medical exemption, medical exemption, incomplete, or no record. Your SIS also has a student immunization list with incomplete, insufficient, no record, and temporary medical exemptions. You don't need to include non-medical exemptions on this list unless it's specifically requested by your local health department. The primary review summary, page 1, plus the student immunization list are due to the health department by January 15th this school year. So do you need to report on students in online learning? Well, yes. If the students may be in some in-person activities or class this year, you're going to want to include them on your immunization report. The answer is no if the student will be in online learning for the full school year with less than 5 on-site trips or field trips. If you have no way to track site visits, it's best practice to collect immunization records for all students, including online students, if you don't know whether they're going to be participating in in-person activities or not. All right, let's go over some February activities. So by February 5th, the local health department will mail letters, exclusion orders to families and also one copy is sent to you. If you are specifically using the SIS Synergy, talk to the county about partnering to print exclusion orders because they can be done through Synergy, but only with the permission of the local health department. And then February 19th, 2025 is the immunization deadline for this year. You need to exclude any students if their records have not been updated as specified on the exclusion order. And students need to be excluded until that record is updated and you have the paperwork on file. If they don't have the paperwork the next day, you continue to exclude them. But you can let them back in as soon as you have that paperwork. So if an hour after the start of school on exclusion day, a student has the documents needed, you let them right back into school. So you're going to want to keep track of how many students are excluded. You can use page 2 of the primary review summary for this. And also, as you're getting those updates from students for their immunizations, enter that data into your student information system. It's super important to keep updated on entering that data as you receive it in that February timeframe, because it'll all need to be entered prior to March 3rd when your report is due. And you'll need to send that follow-up report to the county health department. This is the place on the primary review summary, page 2, where you can keep track of which students had to be excluded or not. On March 3rd, the primary review summary, page 3, is also due if you have preschool childcare or Head Start. And also the primary review summary, page 4, which is required if you have kindergarten, 7th grade, or any grades, kindergarten through 12th. So you'll be able to run pages 3 and 4 in your student information system. A few key tips here. Make sure to use the enrollment date of January 15th, 2025. That was the date that your first report was due. And the reason we do this is we don't want any new students who have enrolled since January 15th to be included on that immunization report. Of course, if students have withdrawn, they won't be included on your report either. And then use the current date when you're running the report as the assessment date. So if you run this report the day it's due on March 3rd, use March 3rd as the assessment date. And there's one piece of the report you're going to have to handwrite. The number of students excluded in Section E, so that's if you have preschool, and Section H, that's if you have K through 12. And the reason for that is your student information system doesn't actually know which students had to be excluded or not, and how many there were. So you have to handwrite in those numbers before you turn in your page 3 or page 4 reports. All right. And then in early March, after you turn in that follow-up report, you are done with immunization review and exclusion for the year. Keep copies of your primary review summary reports from your SIS and any exclusion orders for 1 year. And thank you for your hard work in the immunization review process. It's really important to participate in this process to make sure that kids have the opportunity to get updated on their immunizations at least one time a year, and to help make sure that our schools and childcares can be safe and healthy environments for kids. And a note, if all of your students are complete or have exemptions on file, you can turn in all of the reports at once in January. Wanted to go over some more information for student information systems. We know that many are moving towards electronic registration. So if you're gathering immunization information through your electronic registration system in your student information system. Make sure the words are the same as on the CIS. That's the Certificate of Immunization Status form, the paper form that parents can fill out with their immunization record. If you're getting that information through your SIS, make sure you have the same language that is on that CIS form. Electronic parent signatures are allowed for immunizations in Oregon. And remember, additional paperwork is needed if someone is claiming an exemption. They can't simply input that information through the student information system. You'll need to make sure that you have a vaccine education certificate on file for that exemption, as well as the non-medical exemption section completed on the Certificate of Immunization Status. And make sure that in your student information system, you are entering history of disease or titer as immunity documentation. Do not enter that as a medical exemption. And the reason for that is that a history of disease or a titer or blood test showing immunity counts the student as complete. A medical exemption shows the student as medically exempt and not complete on their immunizations. Some keys to success. Start this process in September. That's when you're going to want to make sure you're gathering those immunization records. Using Alert to look up missing records will help expedite the process. It's sometimes easier to find those records in Alert than getting them from parents. And complete your data entry before running any reports to avoid having to rerun those reports after you complete your data entry. Send parent notices in October or November to give parents time to get an appointment, for their child to get the immunizations, and for them to get their record updates back to you. And when you're running the reports in your student information system, use January 15th, 2025 as the enrollment date, and turn those reports in by those due dates or even early. Here's a reference for Oregon's revised statutes and administrative rules governing the school immunization review process. And if you would like to contact the Oregon School Immunization Team, please email us at oregon.imm@odhsoha.oregon.gov. And if you need copies of the report forms, you can access those at www.healthoregon.org/schoolpacket. Thank you for attending this training.